From government shutdowns to gun control, Obamacare to the economy, Congress has its hands full. Representative Elizabeth Esty is here to answer some good, tough questions about how she thinks they're doing.
And the gun debate intensifies as more gun violence makes news, some involving children taking lives and making headlines. We'll talk with an industry leader about the complicated quest for answers.
Adopted as children, they're now looking for a controversial change in Connecticut law. We'll talk with adult adoptees who are fighting. Hi, you're watching The Real Story. I'm Laurie Perez with Terzi. President Obama still selling the federal health care law, making a trip to Boston this past week as Health and Human Services Secretary Kathleen Sebelius faced some tough questions at a congressional hearing about Obamacare's rocky rollout.
Yeah, it is the issue at the heart of so much of what's happening right now with Congress, and it's where we're going to start our conversation with Congresswoman Elizabeth Esty, representing the 5th District here in Connecticut. Thank you for coming in.
Great to be here.
All right, so Kathleen Sebelius in the hot seat, accepted responsibility. The president's accepted responsibility. Everybody's accepted responsibility for this rollout, and we're hearing it being likened to when Part D came out and the Medicare program, the prescription drug thing. You feel that's accurate? This really seems like quite a mess.
Well, I would say first and foremost, I think we all share the same goals, which is to have quality, affordable health care available to all Americans. So that's really what we're aiming for. Fortunately, here in Connecticut, actually ours is going pretty well.
Yes.
And that's a testament, I think, to the state that embraced this opportunity and said, we want to design our own system that works for our people, that meets our needs. So in truth, Connecticut's being held out as one of the best examples, the most rapid website. You can get on, get off, get the information you want very quickly. I was talking with the manufacturer today. He said he tested it out and he said he was impressed with how quickly it worked. So I think here we are seeing the benefits of having worked together to fix things. Now,
but you acknowledge it looks bad for those who are thinking about this brand new thing coming out, and if it's so rocky with the computers, how can we trust this plan itself?
Well, I think clearly the website is unacceptable. I mean, in this day and age, we need to have that system up and running and working for Americans so you can shop the way you would for Amazon. Go on, search, compare plans. That's the way it's supposed to be working. And I talked with folks in the White House earlier this week. They're well aware that, you know, the public's unhappy, Congress is unhappy with where it is, and it needs to be fixed.
Yeah. I think that's the thing that's stunning to people is that of all of the things to go wrong with this controversial plan, that it's going to be the rollout of the website. I mean,
exactly. But at the end of the day, it's not a website. It's the real proof in the pudding is going to be, are people able to get health care? And frankly, having dealt with folks who were unable to get health care before because of pre-existing conditions, you know, the form is 3 pages because there are no questions about your health status.
Right.
But your Republican colleagues are still saying, you know, why are we still throwing good money after bad? Why don't we just stop this right now and take a look and rethink this whole thing and maybe go a different way?
Well, I'll tell you, I think there are a lot of things that are moving well on this front. An enormous number of people around the country, a lot of businesses, a lot of industry has worked to get ready for this. I think we need to give it a chance to work and work to make it work. And that's what we're doing here in Connecticut.
But now there are some people who are receiving those cancellation notices, right? After the president said, if you have your plan and you like it, you can keep it. Now some people are getting those cancellation notices saying that their plan, I guess, because they don't meet the standards under the new Obamacare, the plans are either getting stopped altogether or they're just getting dropped.
Couldn't the administration have predicted that would happen?
Well, I think one could wonder whether or not that might have been predicted. But again, I think the answer is everyone has access to get plans regardless of their prior health status, and that's what we're working with folks. If we get concerns in our office, and we do, we sit down with folks, we work through them and find a plan that may work for them. So again, it's surely a rockier rollout than anyone would want. But again, here in Connecticut, this is important to remember. Our site's working well, folks are here to help you, and we'll try to find something that works to get your family, your company well set up.
How did you spend your autumn shutdown?
I spent a lot of it trying to get us back open, frankly. Just on the 31st, another colleague and I put together a letter and got 176 of our colleagues to submit a letter to the Speaker of the House saying, please, let's not do this again. The shutdown cost $24 billion. There are a lot of things we could have done with that.
What did they say?
That money. We haven't got, they've acknowledged receipt of the letter. I would hope that the Speaker would say the same thing that the minority leader in the Senate did. McConnell said, we're not doing this again. And truly, shutdown is not the answer. The answer is working together, sitting down at a table, ironing out our differences, and doing better for the American people.
Well, we can hope that, this is being taped on a Thursday evening, that by Sunday when this airs, maybe you will get an answer.
I would love to see an answer, and I'd love to see a commitment of no use of shutdown and no use, even worse, of the debt ceiling as a negotiating tactic. Companies and families and state governments and local governments need predictability to plan. It is very costly to our economy and, frankly, nerve-wracking for a lot of folks. And that's just not, we're not doing our job if we're engaging in that.
I think, though, a lot of people are still concerned, though, that despite the best intentions of people, that as you have to come up with a spending plan by mid-December, that there will be more stalemates and shutdowns, perhaps. I mean, what assurances can you give people that that's not going to happen?
Well, I can tell what I'm doing. I can tell folks what I'm doing because, I'm new to this, and I'm working every day, getting to know folks across the aisle. Just earlier this week, I was meeting with to talk about how he was interested in the workforce development bills that I'm working on. We've got a big new bill. The Competes Act is up for reauthorization, trying to help on manufacturing, workforce development, STEM education, these issues I'm really passionate about for our district.
You have a couple of new bills you put in.
I've got 3 new bills I've put in on environment and energy and STEM education, on skill training.
STEM is what?
STEM is science, technology, engineering, and math.
Oh, yes.
Core strengths for our state, for our country. And the 2 bills, one of them will help companies and better align with skill sets, and the other is actually designed to help teachers, because we found that a lot of teachers, particularly in elementary and middle school, when you need young people to get excited about these fields, they actually don't have enough support. Maybe they're not really comfortable with these fields. And if they can't be enthusiastic, they're not going to be in a good position to encourage people.
And those are coming directly from the talks that you've had with manufacturers saying, listen, this is what we need?
Absolutely. And the manufacturers came to us and said, we want more help. We have openings available today.
And we don't have qualified people.
And we don't have qualified people. And so I hear that every day, and that's why I was working with this Republican senior person from Texas who's really excited and said, let's see what we can do to help make this happen. So I want to assure people, good work is happening. A week ago, we passed a big water infrastructure bill that I've been working on for a long time in my subcommittee, passed 417 to 3. So what you tend to hear, frankly, is a lot of the fighting, but you should know underneath that there are a lot of folks working hard, elected from across the country. We're trying to get some things done. We care about the folks we represent.
And gun control, we're going to be talking about that in the next segment as well, but are you still pushing for the background checks legislation?
A lot of period of time. I think we had an event earlier this week around Domestic Violence Awareness Month, and we had some folks from Newtown, a young woman from Meriden whose sister was killed by an abusive ex-husband last year with a stolen gun. And there are things we must and can do.
But doesn't it still come down to the mental state of the people who have the guns in their hands?
Well, here's an example, though, with background checks. Now, just to give you an example. In the states that have background checks, you have 38% fewer, it's mostly women, killed in domestic violence with guns. It works because that's one of the prohibited categories. If you've got a restraining order, if you've been convicted of domestic abuse, you're not permitted to have a gun under federal law.
Yeah, we
well, if you
find
never ask
cases
that
where
question,
they get them somehow.
if you never ask that question, people aren't going to know whether or not they're allowed to have one. They can do a private sale.
All right.
Continuing issue, certainly.
Yeah, well, I guess we'll have to leave it there. Thank you, Congresswoman,
leave it there,
for coming
but thanks
in.
again.
Thanks a lot for coming in.
Up next, we're going to be talking about gun law and the laws that already have been in effect. One